Today, I'm talking about rheumatoid arthritis. This is the most confusing arthritis out there, except for maybe psoriatic arthritis, which is also pretty confusing. But it's different than osteoarthritis. Osteoarthritis is basically just like you break an ankle, it ruins your cartilage in the joint, and this joint's messed up forever. It doesn't bend properly. But on the other hand, osteoarthritis, you could tweak your knee and you get it in just that knee. If both feet, both ankles, both hands are starting to hurt, this could be rheumatoid arthritis. And the tricky part with rheumatoid arthritis is that rheumatoid arthritis is an autoimmune disease. It is confusing. And what I mean by that is there's not a consensus, even in the scientific literature, exactly what it is. There's different types. There's 3 types of rheumatoid arthritis. There's seropositive. So what that means is there's a rheumatoid factor blood test that they can do, and that means you have it. This is the most common type. It's progressive. It hits the joints get sore, they get better with anti-inflammatory control like icing. There's a less common one, the seronegative version, which means even if the blood test is negative, you could still have it. And then there's the juvenile type. Rheumatoid arthritis does affect the hands and the feet. And if not diagnosed and not treated, this can cause severe damage. I'm talking toes that look like this. And this is not an exaggeration. Ankles that are flattened out like this. So when they land, they're out like this, and toes basically look like that. So when you're 60, 70, 80, and you did not control rheumatoid arthritis, that's what your feet will look like. And your fingers will kind of shoot off to the sides too. But here's the important part is you have normal hands and then they bend a little bit. And then maybe 5 years later, they bend a little bit more. Then they bend a little bit more. And now the joints are gone. Bone starts to fuse. There's no way to reverse this unless you cut the joints open. And even then, it's not great. So when rheumatoid arthritis first starts, there's no major changes on x-ray. And you notice it more in your hands because, let's face it, the feet usually have more of a reason to hurt because you're walking on them all day. But when your hands start hurting for no reason, people get suspicious. And then we look at the x-ray, and what we see is at first a healthy joint, but as time goes on, you could see the cartilage is wearing away. So that's called synovitis. And that's the immune system starting to attack the cartilage. You could see the blue stuff there is wearing away. That's the cartilage. And eventually, number 2, it's called the pannus, because the pannus is a clump of autoimmune tissue basically destroying the cartilage, and now it's starting to eat into the bone. As it eats into the bone, number 3, that's called fibrous ankylosis because your body tries to heal. And as it starts to heal, you can see this fibrous tissue starts to form. This is called fibrous ankylosis. Your joints are already stiff. They're not bending. And as you have a flare up, fibrous tissue fills in there. You're already stiff. You're deformed. And then you go to stage number 4, where that fibrous tissue, eventually as it tries to heal, there's no more cartilage, no more joint space. It starts to turn into bone, and you've got fused bony tissue. And this is why rheumatoid arthritis gets so confusing. It starts with these little green things called antibodies. So those little Y-shaped green things, they bind to the cartilage. So it recognizes the cartilage as a foreign substance. And then those green things are like markers saying, hey, destroy this tissue. And lymphocytes, macrophages, and osteoclasts come, they destroy the cartilage, they destroy the bone. And then you get fibrous union and then bone forming. And why do these antibodies develop against cartilage? Infections, hormones, pathogens, food antigens, heavy metals, drugs, stress, genetics. Nobody really knows. There's not a lot of consensus. It's hard to know for sure. And the tough part is once the damage is done, the joints become eroded. They become destroyed. So rheumatoid arthritis is a horrible disease, horrible disease. It's one of the worst we see. And I see people with all their toes and all their fingers dislocated and fused where only surgery can help it. The symptoms, there's a criteria to get to it, but basically, if it's arthritis, if your joints are really hurting and there's no good reason. So what I mean is, if you work on a factory floor 10 hours a day, that's a good reason for having joint pain. There is an explanation there. But with rheumatoid arthritis, they're just sore. The knuckles are sore. You can barely bend them. They're always red, swollen. They're irritated. They get a little bit better with icing and anti-inflammatory control, but same thing with your feet and your hands. And it's not just one joint. It's not just one hand. If it's one hand but not the other, that speaks against rheumatoid arthritis, maybe different types of arthritis. But if it's both equally, it could be the hands, it could be the feet, or more likely it's both the hands and the feet equally. That's likely something to think about with rheumatoid arthritis. The thing is, you want to catch rheumatoid arthritis early. You don't want to wait, because if you wait, that's when the joints can get destroyed and ruined. So number one, I would do a history and physical. Is there a reason why this is happening? So for example, if somebody's on a factory floor and their feet hurt, and they're later in life and they're getting older and putting on more weight, that's probably not rheumatoid arthritis, although it can be. It's not ruled out quite yet. But on the other hand, if somebody's just sitting at home taking it easy, and they're especially female, because that's more likely in female, and your fingers and hands are hurting equally for absolutely no reason, maybe we should go see a rheumatologist or start getting lab tests at that point. The next thing I would do is get an x-ray and an ultrasound. If there's changes in the joint, then what happens is, if the toes are off to the side, so I'll use the foot, if the feet are off to the side, if they're really flattening out, if all the joints equally on both feet are red, if they're swelling, there are signs on x-rays we look at. We won't really get into this in this video because it doesn't really matter to you, the viewer. But there's criteria we look at to assess for rheumatoid arthritis. But the thing is, if we waited this long, we already waited too long, because what we want to do then is catch it earlier. So you could do blood tests. So blood tests, there's no set defined test. So as an example, there's seropositive and seronegative. No single test confirms it. But there's a couple things that can be looked at is a rheumatoid factor test. So you could check for rheumatoid factor. Obviously, that means it's more likely to be rheumatoid arthritis. There's anti-CCP. So it's, I'm not going to butcher it right here because it's not a test I order all the time. That would be something I would work with a rheumatologist, but anti-CCP, anti-nuclear antibody tests that would show a more likelihood of an autoimmune disease. There's some correlation. And a CRP, so a C-reactive protein. These are inflammatory markers. So the higher your inflammation in your body, the more likely it is. If the history, if the lab tests, if the imaging indicate that there's some risk for rheumatoid arthritis, I would send you to a rheumatologist. I'm not a rheumatologist, and a rheumatologist should be treating rheumatoid arthritis. This is going to be your best friend because there have been significant advances made in the treatment of these diseases. So I'm going to do a brief overview because, again, I'm not the one prescribing these medications, but I talked to my rheumatology friends, and this is their opinion, but huge advances have been made. Before, rheumatoid arthritis used to cripple people. It used to be like guaranteed horrible suffering. But now, if they catch it early, and in most people, while there is no cure for any of these diseases, I will say this, no disease is curable. It's only set off until it hits you again. But they can treat it so well now that remission rates are high, symptoms are very low. I see patients now that have had rheumatoid arthritis for a long time, and it's almost like they have zero problems because they're seeing a good rheumatologist. So rheumatologists are hard to get into to see, and you want to have some suspicion. So check with your primary care doctor, check with your podiatrist, and we can help set you up with an appointment for a rheumatologist. So the first thing you can do medication-wise is anti-inflammatory drugs. So like ibuprofen, acetaminophen, that's your Tylenols, steroid medications. Talking to my rheumatology friends, you don't want to be on steroids for the rest of your life, even though they're extremely helpful, but they're trying to go for better drugs. So disease-modifying anti-rheumatic drugs. So these are called DMARDs. These are medications that try and block the inflammatory cycle. So again, while it's not a cure, it's a management of the disease. This can help a lot of people. The big breakthroughs have been biologics and JAK inhibitors. What these medications do is they stop specific markers within the inflammatory cycle. So interleukins, inflammatory factors. So an antibody specifically can bind to certain proteins. So here I am, an inflammatory marker, and it binds to me. And now this anti-inflammatory marker can't signal the next inflammatory marker. And by blocking the right markers, We can make enough antibodies and put them in your bloodstream, and they can bind to these, and then they can't signal the rest of the thing. And it kind of short circuits the rheumatoid arthritis cascade. It's not perfect, but they're expensive. You know, the price tags on these are crazy. I've seen crazy price tags. You need special insurance for this kind of stuff, or at least get authorized. But this stuff works really well if you can see a good rheumatologist, and they can get you set up for this stuff. Hey, guess what? We have a phenomenal book. I believe this is the premier book on chronic nerve pain and peripheral neuropathy pain on the planet. I've put years of work seeing tens of thousands of peripheral neuropathy patients, working with some of the best diabetic endocrinologists, the best doctors, the best neurologists, in building out this book. For you, my viewers, we have a discount code available. Get on our mailing list and get that book down here.